Hello everyone, this is a model of mural thrombus infarct. So what is a mural thrombus? A mural thrombus is a blood clot that sticks to the inner walls of the blood vessels or the heart chambers. It usually happens when the blood flow slows down or the blood vessels get damaged or the blood has a higher tendency to clot. Globally, the historical data shows that the left ventricular thrombus has occurred in about 25 to 40% of post-MI patients. But with modern reperfusion therapies, rates have dropped to about 10%. A mural thrombus can develop due to various conditions, such as atrial fibrillation, myocardial infarction, heart valve problems, aortic aneurysm, high blood pressure, smoking, infection, such as a bacterial endocarditis, etc. There are three types of mural thrombi based upon their location. The first one is the left ventricular thrombus, which occurs after an heart attack. The second one is right atrial thrombus, which is common in people with atrial fibrillation or artificial heart valves. The third one is aortic mural thrombus, which can happen without any underlying disease or due to artery damage from conditions like atherosclerosis. A mural thrombus can lead to serious health issues depending upon whether the clot is located or if it breaks loose. Heart symptoms like chest pain, shortness of breath, fatigue, irregular heartbeats are the common symptoms. If the clot travels to another part of the body and gets lodged into small vessels, it may lead to complications such as stroke, limb ischemia, mesenteric ischemia, kidney infarction, pulmonary embolism. So this is a longitudinal section of the heart. The walls of the left ventricle are heavily enlarged and there is disruption of 3:1 ratio of the wall of the left ventricle to the right ventricle. However, the wall of the left ventricle at the apex is markedly thinned out and shows scar formation along the grayish discoloration, indicating damaged heart muscle due to ischemia. The heart valves are thickened, deformed, or calcified, affecting the blood flow. Dark, adherent thrombi can be seen in the heart's ventricle near the apex. These clots are partially or completely obstructing the blood flow, resulting in the scar formation. Yellowish fat deposits appear on the heart's outer surface, which indicates obesity, chronic inflammation, and diabetes mellitus. Microscopically, as the mural thrombus is a blood clot attached to the vessel wall, it has three layers: a luminal layer, which is rich in RBCs, fibrin, and apoptotic neutrophils, with fibrin trapping platelets. The intermediate layer consists of dense fibrin network with intact RBCs and neutrophils. The third layer is the abluminal layer, constituting of fibrinolysis and is mainly acellular. The notable features include the lines of Zahn, which constitutes of alternating fibrin and RBCs layer. It is diagnosed mainly using ECG, in which we see persistent ST elevation and T-wave inversion. Imaging tests are done to view the thrombus. Transthoracic and transesophageal are the two main types which are used to view the thrombus in different planes. Then we have cardiac MRI, which is used to distinguish a clot from the normal tissue. The third one is the CT angiography, which helps to find clots in the aorta and other arteries. A newer technology known as platelet scintigraphy, which uses indium-111, which is radioactive and helps to track the clot activity over time. Blood tests such as D-dimer and coagulation tests are done to check the clotting. The treatment is mainly done using the anticoagulants as the first line of treatment. DOACs like apaxivan, rivaroxaban, antiplatelet therapy, Altiplase, which is used for thrombolysis, and surgical options such as thrombectomy, thrombus aspiration, or endarterectomy for high-risk thrombi can be used. The prognosis for mural thrombus depends upon factors such as location, size, underlying cardiac conditions, and timely interventions. The survival rate varies widely depending upon early detection and anticoagulation therapy. However, large thrombi in critical locations can lead to fatal embolic conditions, reducing the survival. Thank you.